It's a treat for me to introduce the next speaker, Dr. Yonat Rum, who's coming all the way to us from foggy London and the University of Cambridge. Yonat will be speaking about sibling relationships and families of children with and without autism, specificity and commonality, according to both siblings and mothers' perspectives.
Hi, thank you, Judah. It is great to online be here. So I am doing my postdoc at the University of Cambridge, as Judah said, but I'm going to talk today about a study that was done in Israel with Israeli families as part of my PhD research at Tel Aviv University and in collaboration with the Autism Center at Asaf HaRofeh Shamir Medical Center. I have to say that the larger project includes also a microanalysis of sibling interaction, as Yana mentioned. This is a very important and useful method, but today I'm going to speak about a specific study that will refer to the siblings and mother's perspective on the relationship. I'm here to highlight the familiar resource that is not often discussed, the sibling relationship at home. We also recognize while starting this project that the fact that we are measuring aspects of the relationship is actually, we're measuring perspectives of the reporter on the relationship. So we included also the mothers and the siblings in this project. So sibling relationships are often the most enduring lifelong relationships, influencing development. Sibling relationship qualities such as companionships and intimacy, warmth and closeness, alongside conflict, competition, and rivalry are common across families. And in this study, we wanted to ask, do sibling relationships fundamentally differ in families with and without autism, according to the mothers and the siblings' perspectives, or are there commonalities regardless of autism? The study utilized a triangulation of information sources. We had two groups of families, those with a child on the autism spectrum and an older, typically developing sibling that consists the autism group, and a group of families with only neurotypical or typically developing children that consist the TD group. We collected data from two reporters from each family, the mothers and the older TD sibling. And we also used a mixed methods convergent design where quantitative and qualitative data were collected simultaneously. That means we used questionnaires and open-ended interviews to collect data from both reporters in both groups. Participants were all from Israeli Hebrew-speaking families from all across Israel. The younger siblings were no younger than 4 years old, and the older siblings were no older than 12 years old, with a sibling age gap of 2.5 years on average, and no more than 4 years gap between the siblings. And we collected data using home visits. As I said, the data was collected for this study as part of a protocol that included also observations on the siblings, which are out of the scope of this specific talk. Each participant during the home visit completed the sibling relationship questionnaire, the SRQ. This questionnaire has a parent version and a child version. Both include the same items. And the subscales of this questionnaire converge into 4 main factors representing qualities of the sibling relationships or main factors: warmth and closeness, conflict, rivalry, and relative status power between the siblings. In the open-ended interview, we asked each participant to share anything they'd like to regarding the child on the autism spectrum in the family and the sibling relationship. To use their own words, to focus on their own matters that seems most important to them. So no other instruction other than the instruction that you see now on the screen, just asking them to tell us whatever they want to share. So when we looked at agreement or disagreement or similarities and differences between reporters, we found that children and mothers in the autism group correlated only in the self-reported conflict between the siblings or maternal reported conflict between the siblings, while in the TD group, children and mothers were correlated for both the conflict and the warmth and closeness factors of the SRQ. While comparing the two groups, mothers significantly differ in 2 out of the 4 main SRQ factors. Mothers in the autism group reported less warmth and closeness and less conflict in their children's relationship compared to mothers in the TD group. And no statistically significant differences were found between the 2 groups according to the children's reports in the main factors. However, they did differ in 2 specific subscales of the SRQ. Siblings of children with autism reported less intimacy and less quarreling than siblings of TD children. With the qualitative data, we conducted a thematic analysis, which basically means dividing all content, all the answers we got from all participants into categories, then grouping these categories into main themes. This analysis revealed 2 themes that were common to all participants, mothers and children from both groups. One of these themes was, we called it inseparable, because it consists of references to the warmth and closeness and conflict, to like the good and the bad that come together, the fighting and the intimacy that comes together in the sibling relationship wrapped in a joint routine. And the other common theme to all participants was the references to disparities and asymmetry in the sibling relationship. We call this theme the younger versus the older. One theme was specific to mothers in both groups and did not emerge from the children's data. So that theme referred to processes in the sibling relationship, including references to the past and also worries, hopes, and thoughts about the future. We identified one more interesting theme that was specific to both mothers and children in the autism group. We call this theme the unsaid word. It included references to the younger sibling's condition, but without naming or tagging the condition, without mentioning autism or any other term to title the condition, even though they did discuss challenges, uniqueness, difficulties. So, as a matter of fact, we heard the word autism only once during all our interviews, and the word spectrum only once. Interestingly, the 2 participants who used these specific describing words were a mother and her child from the same family. So we speculate that it might be that while autism was disclosed in this specific family, it was not in other families who participated in the study. And we point it as an interesting direction for future research. So to conclude, we found in our study that children's reports illustrate more commonalities across groups, while mothers' reports indicate specificity. More disagreement was found between mothers and children in the autism group than in the TD group, with children in both groups being more similar to each other than mothers. Children's perspectives of their relationship, the children's perspective of their relationship with a sibling with autism were more positive than those of the mothers in the family. And the qualitative analysis pointed to the importance of future investigating autism disclosure in the family. In building intervention in clinical or educational work with children on the autism spectrum and their families, we think it's important to consider the sibling relationship in the family, and also to acknowledge the fact that different family members are likely to have different perspectives. We also think that the next very important step would be to learn more about the perspectives of the children with autism themselves. So I want to thank again also to the families participating in this study and in the whole project, my PhD supervisor, Professor Esther Dromi, and the collaborators on this paper, and the Azrieli Foundation for my PhD fellowship, and you all for listening. Thank you.
Thanks a lot, Yonat. It's very nice to see you, and it's a wonderful talk emphasizing that siblings are always siblings, and it's a very important topic.